Welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder. I am also the best-selling author of the books All Rise, The Sickle Cell Community versus the Medical Establishment, and A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. These days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. Hi guys, this is Dr. Simone Yuan here, and today I am actually doing a video presentation as opposed to my live streams that I usually do into my bedtime stories group on Facebook. But I am doing it this way so that I could share it with the other sickle cell groups that I'm a part of. Thank you for letting me be there and letting me share my information as a physician with the rest of my sickle cell warrior sisters and brothers. Today, I wanted to do a quick video on how to get your IV fluids at home. So during the winter is a rough time, and yesterday I actually did a video presentation in my group about vitamin D3 deficiency and how many of us are deficient, but it was a live stream into my group. But someone, during the time I was doing it, I was actually running a home IV, and it just kind of jogged my memory that, I'm trying to multitask, but this is probably a good topic too, which is how to get your IV fluids done at home. So as a physician, when I was practicing, I ordered home health for lots of my patients, but found that when I needed some services, they were kind of tricky to do. And in fact, I didn't put everything together until rather recently. I probably didn't give it much thought, to be honest with you. But this winter has been particularly cold, and so if I try to go out to get fluids now, I would probably get a sickle cell crisis just from stepping out into the cold. So I couldn't do that. But I was also getting sick because it was cold and it was triggering a sickle cell crisis. I know many of you ended up in the ER because of having a sickle cell crisis due to the cold. So how can you get, they say when Muhammad can't go to the mountain, bring the mountain to Muhammad, right? So how can we get the IV fluids to come to us? So the first thing that I realized is that whenever you do a procedure in a hospital, it is much more expensive than if you do it in a standalone facility. So for example, if you needed to get an IV done and you arranged it at a nearby hospital, you're gonna be having to pay attached hospital fees just for having it done in their building or by their technicians than if you were to find a center that did imaging in your area and you were to go to that center, and if all they did was imaging and they did your ultrasound or MRI or whatever, you would actually pay less. Now, most people don't know that because it's not like you look at the bill when it comes, back from the insurance to see what the insurance paid, when you did it in a hospital setting or when you did it in a standalone facility. You don't even know to do that. So knowing this, I have done most of my procedures in a standalone facility and not in a hospital so that I could get the least amount that I have to, pay for an imaging or a procedure. Now, once upon a time when I was practicing, I had to actually pay for these things out of my pocket. So it mattered to me very, very much. But just because somebody else is paying for it doesn't mean that you shouldn't be conscientious about what they're paying, because eventually they will think that they've paid a lot of money for you and they probably have some internal max. And when you hit that max, they will stop providing those services. So the best thing is to look for where you can get things done cheaply. So I found out that if you could do a home health visit and have them do your infusion, because it is not in a hospital setting, it's not even in a standalone facility, and all you're getting is IV fluids and maybe some pain meds. If you need narcotic medications, you're going to need to then go into the ER probably, because I haven't asked them for that kind of medication at home. I have had them give that to me when I was doing IVs in the infusion center, but if it's just at home, I haven't asked for that, and I don't know if they provide that. So that would probably be up to your insurance and then the service that's providing those medications. So I do know that Medicare can pay for this. My husband has a private insurance, so we go with that insurance, but Medicare covers this just as well. So what you want to do is first do it in a facility, in a hospital, at least once. And that gives the insurance a chance to see how much it's going to cost, right? So once they see how much it's going to cost, you wait for like a week or so, and then you call them back and you say, you know what? I think it's going to be very costly if I continue to have infusions in a hospital setting. And I'm trying to save you money. So I'm thinking also that we could help each other, because it's very difficult for me to go into the cold. It can trigger a sickle cell crisis. So I'm wanting to do it at home and through home health care. And I think it will be less expensive for you, and it will be helpful for me because it will keep me out of the hospital. That's exactly what you say. And whenever they hear of someone wanting to save them money, they will jump at the opportunity, especially if they know that without that intervention, you will continue to utilize the services in a hospital, and the bill will land on their desk and they will have to pay for it. So you say it like that, and then you ask them, what would be your copay if you were to do it as a home health visit versus what is your copay when you do it in the hospital? And that's just for your own information to confirm that you are paying less. So in my case, I have Blue Cross Blue Shield, and for the besides the fact that it's more expensive in the hospital, I had a 30% copay with the procedure done in the hospital. They pay 70%, I pay 30%, and I had zero copay when it was done as a home health visit at home. What do you know, right? So that was confirmation that it was better to do it at home. And so after that, you will then ask them, can you send me a list of infusion centers or home health care service providers in my area, in my zip code? And so they'll send you a list, and you start going through that list and asking if they provide home infusions. Some of them will have it as one of the prompts, like if you're calling for infusions, press 4. So you know right away that they offer that. And then you get your hematologist to, once you know which company you're going to be working with, you get their fax number, their phone number, and you call your hematologist and say, listen, I am trying to take care of myself, and I cannot go out into the cold because it's triggering a sickle cell crisis, and I'm trying to keep myself from out of the hospital, because when it gets to that point, I'm going to need narcotics and I'm going to need hospitalizations. So I'm trying to just do it at home before that happens, kind of as maintenance, and that way I don't have to have pain medications or maybe not as much pain medication. And of course, that'll be music to their ears. And they'll say, sure. And so they have a coordinator or a nurse planner who will then send all the information with a face sheet with your demographics to the company, that the home health company that you gave them the information for. And then that home health company will then contact you saying, I have, a new requisition for you for IV fluids. What I would do is I would call back my hematologist to make sure that they faxed it in, wait for 24 hours, and then call that home health service to make sure that they know that you're on top of it and you want it like yesterday, please. And so they can start to work on it. Now, of course, they want to be paid, so they will try to work on it as soon as possible. If they are not working on it fast enough, as was the case with me with the first provider that I contacted, they subcontracted and gave it to an infusion center that was not working for me. So I called them back and I said, if you can't find me an infusion center in the next 24 hours, please let me know, because I will ask my doctor to send my file to a different company. And I will make sure to tell my doctor that you guys really can't provide this service. So if any other patients are asking for this service, he probably shouldn't send them to this company. And so that's only if you need to. There's no need to, say that if they're working with you. But if you're encountering resistance or slowness, that's how you handle that. And you don't have to be rude or disrespectful. You just tell them the facts. And hopefully within a matter of a few days, and you start out early, start out when you don't need the fluids, because when you do need the fluids and you're in pain, then you're going to be cranky, and then you're going to be more liable to break when things don't go your way. So start out asking for, infusions twice a week as needed, and then you can decide when you want them to come once they start the process. I hope that was helpful, and good luck to you guys. Talk to you soon. Bye. Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you benefited from this episode any at all, please like on the video, subscribe to the channel, and share the video with one other person as your good deed towards the sickle cell cause. Have a great day. If you would like to contact me to speak in your area, please don't hesitate to email me at drSimoneSays@gmail.com. If you are the one referring me, please let me know so that I could send you a nice thank you surprise.